Good evening, viewers.
Hi, my name's Nick.
And I'm Jeff, and we are ISU OT Master Students. And today we'll be doing an educational video over a patient with MS.
You might say, what is OT? Occupational therapists help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities, which are occupations.
Common occupational therapy interventions include helping children with disabilities to participate fully in school and social situations, helping people recovering from injury to regain skills, and providing supports for older adults experiencing physical and cognitive changes. Why are we doing this video? To educate clients living with MS as well as caregivers and professionals on compensatory strategies in order to complete housework activities using energy conservation techniques.
Who is our audience? Individuals with MS and caregivers and professionals caring for the individuals with MS. What are our learning objectives? So the first learning objective is to provide multiple compensatory strategies and how to implement them into doing the dishes, vacuuming, completing the laundry, and making the bed.
Other learning objectives include understanding the importance of energy conservation and the strategies necessary to decrease fatigue, identifying activity and environmental modifications that will provide simplicity and energy conservation for task completion, and then also demonstrating the compensatory strategies integrated into the dishwashing, vacuuming, completing the laundry, and making the bed.
So who is our client? Our client is Derek, and he's a 31-year-old male. He was diagnosed with multiple sclerosis, the relapsing remitting stage. You might be asking, what is MS? MS is multiple sclerosis, and it is a potentially disabling disease of the brain and spinal cord. This affects your central nervous system. In MS, the immune system attacks the protective sheath, called the myelin, that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause the nerves themselves to deteriorate or become permanently damaged.
Okay, what are the common symptoms? Signs and symptoms of MS vary widely and depend on the amount of nerve damage and which nerves are affected. Some people with severe MS may lose the ability to walk independently or at all, while others may experience long periods of remission without any new symptoms. The most common disabling symptom of individuals with MS are fatigue and weakness. Other symptoms include difficulty withstanding for long periods of time and balance. Also, cognitive issues and cognitive fatigue. The main cognitive area includes planning, memory, word finding, and decision making. Or it could just be generalized fatigue or slowed information processing. There are also sensory changes that can occur, some visual changes including diplopia or double vision and visual field loss. Other symptoms include dizziness, vertigo, sexual dysfunction, depression, slurred speech, and bowel and bladder dysfunction. For our housework activities, we will be working on washing dishes, vacuuming, doing laundry, and making the bed. For general compensatory strategies, we will include breaking down the task into smaller goals and small steps, making sure to take breaks between steps, and creating a rest schedule. Also doing an activity analysis and modification to determine what works and what doesn't work, and how can I modify this task I just completed, and also just including self-awareness. We will also be looking at proper body mechanics, ergonomic principles, which include energy-efficient tools in the home and at work, proper positioning at workstation, and then modification of the environment. For the environment, we will be looking at changing the work heights, location of equipment, and rearranging the work area. We will also be looking at setting priorities to determine which tasks are necessary at the given point, scheduling the day, and making one day for laundry. And then we will also be using a dishwasher for energy conservation if it's available.
Next, we will focus on communication. We will make sure that he has the ability to ask for help. During our activities, we will plan for each day throughout the week how he will perform those activities and make short-term and long-term goals for those activities. We will make sure during our activities if he needs adaptive equipment for those activities.
Okay, this is Derek. Derek is a 31-year-old male who enjoys watching football, playing euchre with friends, and eating Chinese food. He currently lives at home with his spouse and has 2 steps to enter the home in a ranch-style home. He reports being tired throughout the day and unable to complete routine activities. Today we will be observing him doing a routine kitchen task of washing dishes. Okay, go ahead, Derek.
Start?
Yeah.
Okay.
Hey Derek, good job washing dishes. So some things I noticed were the very first thing is that you lost your grip while using the sponge. I would recommend testing your grip strength and comparing it to each hand and applying some exercises. So some exercises that you could do if you do have poor grip strength would be to do a composite flexion exercise with putty where you make a fist and push down into the putty while you're standing and make sure and put the putty on a flat table-like surface.
Okay.
Another exercise would be to pick up a spring hand grip and just start using it every day. I also noticed that you showed difficulty with coordination when turning the faucet on and off and you were dropping silverware. For this, I would recommend completing a fine motor coordination assessment in the standing position like the Bits or the O'Connor. For exercises to increase coordination skills, I would include placing rubber bands on a dowel rod with one hand. That would help, and then also squeezing a rubber ball. I also saw that you forgot to wash one of the utensils, so it may be beneficial to learn the lighthouse method. If you're not familiar with the lighthouse method, you imagine yourself as a lighthouse with your eye being the light, and just make sure to scan your entire visual field so you're not forgetting anything. This is one technique. Also, you could use a technique called anchoring. For this, you would place all the dirty dishes on a mat next to the sink that has high contrast and make sure you clean everything on the mat every time, and that would be your starting point every time.
Okay.
I also noticed that you were a little bit tired and leaning against the counter. So I would recommend just taking breaks while you're washing dishes and leaving the dishes out to air dry instead of towel drying them. And then if you do have a dishwasher, which I saw that you do, I recommend just rinsing the dishes off and just go ahead and use the dishwasher. Okay, now just for some general tips for conserving energy in the kitchen. Use a jar opener for tightly sealed containers. Don't close bottles or jars too tightly once they're open.
Okay.
Use an extended lever to open lift tab cans. Use pans with a wide base that you can't knock over easily. Use a food processor to chop vegetables because it's a lot easier and you save energy. Using plastic containers because they won't break. And then storing food and drink in small, easy to manage containers. Also, just place utensils, pots, pans, and measuring cups on a pegboard or an accessible cupboard instead of in lower cupboards. That way you don't have to bend out to reach them.
Yeah.
Also, just if it's possible, just to sit when you're getting things out of lower cupboards. And then when you're cutting vegetables, you can use a spike board to make it a little bit easier. And then just make sure to use two hands when pouring liquids if you're having difficulty. And then using electrical appliances whenever it's possible. Okay, now we will be observing Derek while he vacuums. Go ahead, Derek.
Okay. Oh, I hate this darn thing. Already on.
That's okay, keep going. good.
You're done?
Yeah.
I'm gonna go ahead and try to put it away now.
Yeah. Okay.
Alrighty, good job, Derek.
Okay, good job vacuuming today, Derek. Now we're just going to talk about some things that I just noticed. I noticed that you became tired easily and were just leaning against the walls. So for this, I would just recommend some exercises to increase your walking tolerance. So just making sure to walk outside once a day when it's nice out, or go to the gym and walk on the treadmill, or even doing swimming.
Okay.
So any of those exercises would work, and I would recommend doing one of those activities for at least 30 minutes a day. Another strategy could be that you could just use a cane while you're vacuuming, so you have the vacuum in one hand and the cane in the other hand, and whenever you're tired, you just kind of lean on the cane a little bit. I saw that you couldn't lift the bean bag and that you had items on the floor, so I would recommend obviously cleaning up the items off the floor first before you vacuum. So do you normally pick up things as you're vacuuming, or do you do it before you vacuum?
I normally do before, but I think just this time I kind of forgot. But I sometimes forget a couple of them on the floor, some just dumb little items.
Okay. So for that, I would recommend placing a visual schedule in the closet that you keep the vacuum in that shows the steps for vacuuming, and then have cleaning up the area as your first step so you just don't forget.
Mm-hmm.
I saw that you also forgot to unravel the cord all the way and you had difficulty covering the whole room with the vacuum. So my recommendation would be to count the number of times you unravel the cord to make it easier to remember, and just remember that number. Or you could also figure out how much cord you need and place a piece of high contrast tape on the spot on the cord where you want to stop unraveling it, and make sure to do that every time. That way you'll have enough cord and that you won't be bending over to pick it up all the time. So also, getting to my next point, just make sure to hold the cord in your hand while vacuuming so you don't have to keep bending over to pick it up, and it makes you tired more easily. And then also you wouldn't want to accidentally vacuum over the cord. And then I also saw that the vacuum became increasingly difficult just to push across the carpet.
Mm-hmm.
So for that, I recommend doing some rows with a resistance band. So for that, you just make sure the door is closed and you tie the resistance band to the push side of the door while you're facing it, and then you keep your elbow flexed at 90 degrees, and you just do a shoulder extension backwards with the band in your hand, and make sure not to go past about 70 degrees of shoulder extension so you don't tweak your shoulder or anything like that. I would recommend 3 sets of 15 reps twice a day, and then you would do each arm.
So like this far?
Like this. Yeah.
Okay.
Right there. You wouldn't want to go any further. Also, for that, recommend you could just play billiards, and that would kind of increase your push-pull strength and coordination a little bit.
Oh.
If you're a billiards fan.
I love it.
Okay, I saw in the end that you were leaning against a chair to vacuum under the table. So I would recommend just to go ahead and sit down in the chair while you're vacuuming under the table. It just makes it a little bit easier. And you don't really need to necessarily vacuum under the table unless it looks messy. I would just try to stick to making sure to vacuum the high traffic areas of the carpet if you're tired, for the areas that people are mainly at. And then when you're done, just make sure to unplug the vacuum first before you wrap up the cord, because the cord will be a lot easier to wrap up.
Okay.
Alrighty.
Okay, Derek will now be simulating doing laundry.
me start?
Yeah, go ahead and start.
Okay, well, here's the dirty clothes. Pick them up. Please. Make sure they're dispersed, because then it just rumbles, you know?
Mm-hmm.
I gotta reposition that crap. I'm a little dizzy. Might do a little more. I'll save the reds for later. Now throw this handy dandy pod. That's the washer. A lot of clothes. Good.
Yep.
Make sure all the clothes are dry. A lot of jerseys.
Yeah, you do.
Keep dropping the freaking socks. This one up. arms are getting tired.
Huh.
Smell good though. It's a little damp. I remember that shirt.
Any pain level?
I'd say just like not as much pain, but like tired.
Just tired.
A lot of clothes. Probably could have done a little less. Calvin Klein. Okay. Found two. Wait. Yeah, they're both out of place. No, no, no. Two lefts. All right.
Alrighty, good job.
4, 5, 6 pairs.
Okay, so you just finished doing laundry. I noticed that you had to bend over multiple times to pick up your clothes. One thing, I think it would just be a good idea to place your dirty clothes in the dryer because it's directly above your washer and you won't have to bend over as much and you can save some energy. And then also for that, you could put 2 different color magnets on top of the dryer, like a brown one and a blue one, and place the brown one actually on the dryer when you have the dirty clothes in there, or put the blue one on there when you have clean clothes in there just to keep track.
Okay.
Also, I saw that you were mainly using your back muscles when bending over to pick up your clothes in the laundry pods. So I would just recommend just making sure to keep your back straight and having proper lifting techniques, so making sure to bend your knees rather than bending your back when you're bending over to pick up items. And then also just try to bend over as close to the object as possible so you're not having to reach and use your back, and it will also reduce the risk of falling forward. And then I just noticed that you were having difficulty reading the knobs on the washer. So for that, you could just use a colored Sharpie with high contrast to white just to mark the setting where you want the dial to be when you're turning on the washer. I also noticed that you didn't check the pockets of your clothes before you put the clothes in the washer, so just make sure to do that. You could, to remember to do that, just place a sticky note on the washer, and that'll help you, give you like a visual cue to help you remember just to check your pockets. Since you were tired of folding all that laundry, then I would just recommend doing a lighter load. And then also hanging up the clothes so you don't have to fold as many clothes. But you did a overall pretty good job of folding laundry.
Okay, Derek will now be making his bed. Alright, go ahead and make your bed. Alright there?
Woo. Oh, dizzy.
Oh, dizzy? All done?
Yeah. Okay, so you've just finished making the bed. I noticed that it took you a little while to make your bed, and you became winded and then also dizzy when you stood up. So just make sure to not stand up so fast. And then also you kind of just rolled out of bed and used your back and didn't really use any of your other muscles. So I would just recommend you remove the covers and then bend your knees, move to your side, and then kind of dangle your legs over the edge of the bed, and then just use your right elbow if you're leaning to your right and your arms to lift yourself upward so you aren't putting as much stress on your back. And then just when you're getting out of bed, just to make sure you have your feet flat on the ground just for balance purposes. And then also with making your bed, I feel like it took you just a while, so I would recommend just stretching your arms and grabbing hold of the bedding while you're in bed, and then just kind of line up the edges while you're laying in bed before you get out of bed, and then flapping the bedding kind of like a parachute just so everything's even, and then lay back and fold the top of the blanket over, and then just scoot out from under the sheets using your arms, and then it would just make it a lot easier to make your bed without having to get out of bed and walk around to the sides of the bed. Alrighty?
Yep.
Okay, now we have some questions for the audience to answer. The first question is a true-false question. The lighthouse method is a beneficial way to compensate for missing steps when completing a task. If you answered true, then you are correct. Number 2, what is the best way to conserve energy when washing the dishes? Is it A, washing and drying each item by hand, B, washing by hand and air drying the items, C, rinsing the dishes and putting them in a dishwasher, or D, washing by hand and putting them in a dishwasher? If you answered C, rinsing the dishes and putting them in a dishwasher, then you are correct. That is the best way to conserve energy when washing the dishes. Number 3 is a true-false question. It is beneficial to get out of bed as quickly as possible in order to conserve energy. The correct answer to this question is false.
The next question is, which activity would help to increase grip strength? Is it A, playing catch with a baseball, B, playing table tennis, C, playing Uno, or D, swimming laps in a pool?
If you chose answer A, you are correct. Playing catch with a baseball. The next question is, which is the proper way to pick something up off of the ground? Is it A, bend over with your legs straight, B, squat down with your back bent over, C, squat down with your back straight, or D, bend over lifting one of your legs up behind you? If you chose C, you chose the correct answer.
Well, that's all we have for you today. I hope this video was beneficial for learning how to increase independence for individuals with MS. We would like to thank you all for watching, and if you have any questions, comments, or concerns, then please place them in the comments section below. Thank you.